All right, so this next group of drugs are the alpha glucosidase inhibitors. And there's really only two, acarbose and miglinol. And what these do is, from a mechanistic standpoint, they competitively inhibit this enzyme called alpha glucosidase, which exists in the small intestine. And so when you inhibit that enzyme basically exists to kind of break down these complex carbohydrates into simple carbohydrates, which facilitates their absorption. By inhibiting the enzyme, these carbohydrates don't break down, and they don't get absorbed. And so what they do is they kind of just stay within the GI system and become undigested. And of course, the main side effect would be kind of a GI discomfort from all this undigested carbs that are moving through your colon. From a primary targeting standpoint, we're looking at post-meal glucose targeting. And these drugs are pretty good at reducing the post-meal glucose concentrations, 40 to 50 milligrams per deciliter up to. We don't see really dramatic decreases in A1C, anywhere from 0.3 to maybe 1% reduction. And as I said, the most common adverse effect is, flatulence or gas and abdominal discomfort due to all those non-digested carbs moving through the colon. You can see elevations in transaminase, specifically from acarbose or acarbose, and it's relatively rare, but it does exist. These drugs are rarely used just because they're not tolerated. But there was a study listed there that demonstrated acarbose specifically reduced the risk of cardiovascular events in patients with IGT. So IGT, impaired glucose tolerance. And typically we'll treat, this drug can be used to treat, we can use oral glucose to treat the hypoglycemia that can come about from this drug, or this drug class. That's pretty much it for the alpha glucosidase inhibitors. From a mechanistic standpoint, of course, we're looking at the GI system and not the liver.